that was my subtle way of making sure that I didn't accidentally get on video, so I can go get a glass of wine.
There you go.
There we go. Can you hear me now?
I did for a while.
All right. I think that we had a power problem with our new mixer here. We're trying some new technology. Normally, you do not see me during our town halls, and there is a reason for that. So we have got this all figured out. So anyway, thank you, Commissioner Cribbins. Thank you, Commissioner Sweet, for joining us. We do have some questions that popped up in our COVID-19 email address. If anybody else has questions, please email us at covid19.questions@chw.coos.or.us. You can also ask questions in chat, the live chat on the right of the screen. So hopefully we get some questions filing in from there. I'm gonna answer just a few questions that popped in that are not reopening related. One of the questions was, how many of the 28 cases are Shutter Creek and local transmission? We have 30. Technically, we still have 30 cases, 2 staff, 25 adults in custody, 2 presumptive cases, and 1 in the community. So that is the most up-to-date numbers that we have right now. Another question about Shutter Creek, are the positive AIC cases being moved? Yes, since this began, the positive adult in custodies were transferred to Coffee Creek up in the Portland area. So that is still happening. And another one regarding our presumptive cases. I know that presumptive cases have been a newer addition to our numbers that have been popping in, and presumptive cases are not positive cases per se. They are cases that have had close contact with a positive case, are symptomatic, and have had a negative test. That doesn't necessarily mean that they won't eventually have a positive test, but they have a negative test, and based on the symptom profile and their close contact with a positive case, they're being considered presumptive. So that is kind of how that whole thing works. So let's get to the reason we're here. Reopening. Commissioner, I guess Commissioner Cribbins or Commissioner Sweet, I guess it depends on which one you guys want to ask. Do you want to just give an overview of what the process has been like for applying for reopening and what that's meant for us?
Sure.
Melissa,
I'm happy.
Better one to answer this.
I was going to say I'm happy to take it from my perspective, and then John, Commissioner Sweet, maybe you could fill in with some of the, the really detailed work that you've done, like with parks. And the Forest Service and the BLM and state parks, which would be great. So from my perspective, we've been participating in conference calls with the governor's office and Business Oregon and Regional Solutions for the last few weeks. Also the Oregon Health Authority, as the criteria have been evolving for what it's going to take to reopen. We got word officially near the end of last week that the Shutter Creek cases would not prevent us from participating in the reopening and meeting the minimums. And then on Thursday, it was officially announced that the prerequisites included 5 hospitalized cases, which made it very clear that we were in a reasonable situation to apply for reopening. We did draft our reopening application, which is about 10 pages, and has 7 criteria that are required to meet for prerequisites in order to reopen. We sent that to the governor's office. We were informed that we had put some guidance at the end for businesses to help them to understand what would be required of them for reopening. They wanted that removed because they wanted all of those decisions to be made by the Oregon Health Authority, and didn't want to cause any confusion, so they asked us to remove those. They also wanted to make sure that we had certifications from all 3 hospitals in Coos County that there would be adequate personal protective equipment in order to reopen a minimum 14-day supply. We had communications with the hospitals over the weekend. They got those to us first thing Monday morning, and in one case Sunday night. And we got the whole package resubmitted on Monday morning by 10 a.m. And by Monday afternoon, we received notification that our package was deemed complete and had been forwarded to the Oregon Health Authority for a final decision. So at this point, we're awaiting a final decision. We're told that that will come sometime between today and Thursday. I think we can probably safely rule out today at this point. That will mean, though, that restaurants can reopen with some social distancing requirements. There are webinars for all of these businesses so they can understand exactly what their requirements are. They're being put on by Business Oregon and some specialists in the area, such as the Oregon Restaurant and Lodgers Association. Beauty salons will also be able to reopen, so everybody can finally go and get a haircut, and I can be out of the beauty salon business at my house. And gyms will also be able to reopen. We're also told that retail will reopen on Friday. Commissioner Sweet?
Okay. The parks, for some reason, public parks were kind of taken out of the other economic sectors and allowed to open last Friday. We got word from the state on Wednesday that we could open our parks Friday. We chose to open 5 of our parks, the ones that are most popular. We restricted that first week occupancy to just citizens of the county. We only booked every other camping space in the parks to make sure that there was no overcrowding. We restricted the parks residency or occupancy to RVs and camping trailers, thinking that we did not have the capability to maintain the restrooms and showers in a sanitary condition necessary given the virus that we're fighting. We had a very quiet opening, not much utilization of the parks, no problems whatsoever, other than we did not have day use. I'll back up and want to say that. And the reason for that was because we didn't feel that we had any control over the day use crowds. The camping sites had to be reserved ahead of time, and so we could control how many people would show up to camp. We did have the word didn't get out exactly as it was meant to, and we had some people show up to use the day use sites, and of course that no one liked that. So that was last weekend because everyone was very orderly, and we had what we thought a very successful soft opening, that we would open it up a little bit more for this coming weekend. So starting Friday, residents of counties in the southwest quadrant of the state, which would be Coos, Curry, Douglas, Josephine, Jackson, and Lane County residents would be able to make reservations for overnight stays at our parks. Again, they would be well spaced out. Only every other camping spot would be occupied. We did relax the day use limitation. We had some people that were ready to picnic and ready to go swimming and thought we should be able to allow that, which we're going to do at Powers and Laverne. The day use part of Riley Ranch, where is the place that most of the people like to use the dunes go, will be closed. And the reason for that, unfortunately, is that we have a construction project going on, and that process started just today. And so the parking lot will be filled with, it'll be the staging area for the addition of some new high-end RV spots there in the campground. We've been working with state parks, BLM, and U.S. Forest Service to coordinate activity. State parks announced today that they're going to open their South Coast parks, amongst others in the state, for day use only. So that will take some of the pressure off of that we would otherwise have expected in our parks for day use. We've consulted with BLM about opening their park at Bastendorf Beach. They acknowledge that it seems a lot easier to get permission to close the park down than to open it up, but they're working on that. And we've asked U.S. Forest Service to allow general use of the dunes. Last weekend, for some reason that I don't fully fathom, they opened the dunes, but only to people who were camping at Riley Ranch or at a county park in Douglas County. That seemed unfair to the private sector, who also have campsites near the dunes. And so hopefully that limitation will be changed yet this week, but that's kind of beyond our control. So that's where we are with our parks, and that's the only thing that we've really opened so far in the county. And I'm pleased that and looking forward to our businesses being able to hopefully reopen starting Friday.
All
That's
right.
what we're working towards.
Fingers
Yep.
crossed. I know that we had a question. I think it kind of piggybacks on the parks thing, and it's not necessarily a county parks question, but do we know if city parks are going to be in the plan to open in the first phase, or who's responsible? I would imagine each of the cities themselves are responsible for opening their parks, but is that part of the phased approach that we know of?
Well, to my knowledge, the city parks have not been closed. Now, I walk quite often at Mingus Park, and it's certainly not closed.
I know that just from myself driving around, I know that Coos Bay has had some that are taped off, like police tape. Boynton Park and North Bend's play structures are all taped off. You can go to the park, but you can't if you take your kids.
Okay.
Play on it now.
Okay, I see what you're saying there, Eric. I know in our park, in the county parks, we're not allowing use of the play structures because we don't think we have the capability of sanitizing them sufficiently.
And I could definitely see that as being a problem for cities, counties, states, anybody that has play equipment in their parks. The ability to properly sanitize those is almost impossible when you think of the high use that they would get.
Yeah.
One of the questions we have is explain why we need to open up in stages and not all at once.
I'm happy to take that from my perspective, although that might be a better question for you guys over there at Coos Health and Wellness.
Yeah, it may be. I think everybody has a way to look at it. So if you want to take your answer for it, then I can follow up with what kind of our answer.
Right. I would say, although it may not feel like it right now, looking back, we did close down in phases,
Mhm.
and reopening in phases is something that's being done in order to make sure that we're still continuing to flatten the curve. And that's something everyone needs to be really mindful of, is the fact that reopening phase 2 is not guaranteed. And the governor's office, as a matter of fact, has not really given us good guidance to what phase 2 is going to look like, whether there'll be another set of applications or whether it's going to be automatic in 21 days. What we know is that everybody's going to continue to be closely watching the number of cases and the number of fatalities, and also the amount of PPE and hospital beds available. And those things will all play into the decision of whether or not we move into phase 2.
Yeah, from my viewpoint, I view it as a very responsible approach to reopening the economy. People don't always agree with this, but I think we have to figure out how to live with this virus. We can't stay shut down forever. So I think a phased approach is a cautious approach. If we see that we've overstepped, it's pretty easy to phase back. I just think it's a good approach to take. If we relaxed all restrictions, and we wouldn't know, it would be hard to phase back again, I think. And I think the chances of we're going to have some people get sick, I'm afraid, as we open up these phases. But we have to make sure that it's controlled at a reasonable level. So I'm very pleased to the state's approach to this. Not everyone is. A lot of people think this is ridiculous. We should open up. I absolutely disagree. I think the reason that we have such a low incidence of the disease in Oregon is largely because of the precautions we have taken as a state. And I hope that people continue to approach this very cautiously. On the other hand, I think we have to move ahead and attempt a responsible level of reopening our economy. We have too many people that are suffering because of it.
Yeah, I think I can kind of piggyback on both of you. I think both of you have made very good points for the phased reopening piece, and it would be irresponsible from a public health approach to open up everything all at once based on what we know of the virus and how it spreads, and the fact that we don't have a barrier to the virus. There's no vaccination at this point, right, for COVID-19. So understanding that and knowing that by slowly opening things with restrictions, as in restaurants, and with the use of still proper social distancing in order to maintain that prevention piece that we've been pushing since the beginning of this, about washing your hands and not touching your face, and wearing a mask, and just making sure you're responsible with where you are in relation to other people. Doing that and then slowly rolling things open makes sense. I think phase 1 says that we can do some of these openings of some of the things that you've mentioned already, especially I think restaurants is the easiest one to piggyback on because a lot of people miss going out and eating. But 25 people in groups, if you were going to try to do something, would be the max under phase 1. And then as Commissioner Cribbins, you said that there's no guarantee we make it to phase 2 based on how the 21 days goes from the time that we start, depending on what we see in the numbers. But in the event that we were to go to phase 2 in any fashion that the state requires us to do it, like you said, if they make us do the application process like we did for phase 1, I think that it's responsible for us to know, if in those application processes, that we know that we have an answer for these things, or we have a plan for these things going forward. And we didn't do all of this work to then just say, hey, we did it, mission accomplished, we win, we can open it all back up. So I think that it is a responsible direction to go in the phased reopening. And I'm optimistic that with the community coming together to continue to help move this forward, we can get there. Maybe not right away, but we can get there. All right, let's see. Another question says, do business owners like myself need to plan on proving our readiness with inspection, or will it be more with the trust and education of the law and stipulations of the licensed facility? I don't know what business they would be referring to, but I guess it could go to anybody. I don't know, anybody trying to open back up that would have been closed. It's not an essential service.
I'll take a stab at that. And Melissa, I wish you would add to this, because I'm sure you have a lot more to say about this than I do. But I really think that compliance with almost all of our laws is largely dependent upon individual responsibility. And thank goodness we, by and large, have a population that accepts that and are responsible and try not to do things that are illegal. I just don't think if everyone wished to break every law there is, that there'd be enough law enforcement capability to handle it. So to a large degree, we're dependent upon people obeying the laws. And generally speaking, the laws are there for good reasons. So what the specific enforcement of the limitations or restrictions will be, Melissa, you're better to answer that. You're a better one to answer that than I.
I don't know if I have a good answer to that. The truth is the county doesn't have the time or the resources to come out and inspect everybody before we get everybody back to work. We want businesses to reopen just the moment that we have our plan approved and it's available. So we are dependent on our businesses to follow the rules. And I would say, I've heard from a lot of business owners over the last 6 weeks, as I'm sure has Commissioner Sweet and Dr. Gleason. And business owners want to do the right thing. Nobody wants to make anyone sick. Everybody's very, very concerned about doing the right thing. And the guidance has changed as we've gone on, which I think has made that harder and harder for people to be confident that they're doing the right thing. So I would urge business owners to reach out to their professional associations, reach out to the state. There's guidance on the Oregon Health Authority's website on what businesses should be doing. I talked to a representative from the Oregon Restaurant and Lodgers Association yesterday, and he said, absolutely, they're giving guidance to their restaurants, and they are, letting them know what they can and can't do. I have, spoken to several business owners over the last few days who have wanted to know, what we think of their plans. And I've told them, I'm no expert, obviously, on, what restaurant reopening plans should look like. But if they need supplies, if they need PPE, the Southwestern Oregon Workforce Investment Board has PPE that they're selling at cost, and they're happy to help out. And really, I think all of our goal is just to get people back to work safely and in a way that still protects our communities.
I think Melissa mentioned this, but I'd like to emphasize that these standards that are being asked of each economic sector as regarding controlling spread of the disease were not made up by just a bunch of bureaucrats in Salem. They engaged with business owners and business associations to come up with workable, effective guidelines for how to operate, how the businesses might operate without risking without risking the spread of the disease. So if the businesses or other business owners or their associations have had a lot to do with the restrictions that are being imposed upon each business sector. And I think it's important that we have this, and so that we have a level playing field. It would not be fair to have some businesses be responsible and be undermined by other businesses who are not being responsible.
Absolutely. I know that we had a question in our live chat on the YouTube regarding places of worship. I know that we've had discussions regarding that in theory, but I don't know that where we're at on the actual plan for those.
I don't either.
I know that in theoretical conversations we've had about places that would be where individuals might congregate to see or have a service, like a faith-based organization, theaters, any place that would have the capacity for congregating, right? And even though we don't have a guidance on that, I don't think at this point, as far as a hard and fast rule, I know that that's something that we are discussing from our public health side as to what that would look like for maintaining social distance. And I think that that's really one of the keys to all of this in any of the businesses that are going to open up, that the ability to maintain that social distance and use the personal protective equipment properly in order to still conduct the services that you provide, right? Whatever those are. If it's a place of worship, you're probably going to want to put 6 feet between the individuals that are sitting within those rows, with the exception of maybe the individuals that live together, right? Because we've kind of come to the conclusion that if you live together, you probably already know what your germs look like as far as that goes. But the other people that come into your place of business might not. So if you go to a movie theater, do you have to mark off specific seats in order to maintain that social distance? I think that that's something that is going to play itself out as we go along, and we'll have a better understanding of what kind of restrictions that maybe have guidance by the state versus how much you might be able to do based on your specific business.
Yeah. I mean, for now, they're clearly still subject to the no more than 25 restriction.
Right. Yep. Phase one, 25 people.
Yep. Which is difficult for a lot of churches, but I also know that, for me and for Commissioner Sweet, there was a lot of time spent before this driving back and forth to Salem, for meetings, that sort of thing. And my hope is that, if nothing else good comes out of all of this, we do better about finding other ways to bring people together, even, in times when it's not easy to be together. So I know that all of our video conferencing skills have improved over the last 6 weeks, and it won't work for every business, clearly, not for a lot of businesses, but for faith-based communities, there are opportunities to bring people together that maybe can still respect social distancing.
I absolutely agree. And I think that you've seen a lot of leveraging of technology in this pandemic response from especially the faith-based community. I know a lot of people that I've seen on social media, my friends, my family, that are having church services in their living room with their families, as those pastors and groups have started to do these virtual church services so that they're still able to connect in some fashion. Maybe they're not having their potlucks and seeing each other like they're used to doing, but they still get to enjoy the services that they've been accustomed to. And I think that we've seen a lot of leveraging of technology to the fact that I don't know that you can necessarily put the cat back in the bag completely as far as how businesses are going to look going forward.
Absolutely. And it's been kind of fun to see some communities have been bringing back drive-in movie theaters, which always hold a special place in my heart. And you can use that for church services too.
Yeah. All right, let's see. We have a question that said, what have we learned?
Can we pursue that last statement a little bit further here about
Yeah.
this special place in Melissa's heart the drive-ins have?
I like drive-in movie theaters, John Sweet.
Okay.
I'd like to point out, Commissioner Sweet, that I think that Commissioner Cribbins is just hit with a bit of nostalgia. It is her birthday today, so she gets to go back and think about all the things that have made her happy in her life on this special day.
Okay.
That's true. Right. Thank you.
Enough said.
You're welcome. What was I going to do? Okay.
Never invite us again. That's probably what you're thinking.
I think he'll invite you, just not me.
Well, I
think you're safe.
It's actually more fun if you're involved because we never know exactly what's going to be said. So we have a question that says, what have we learned regarding disease spread and economical rebuilding from other states that have reopened several weeks ago, is there a forecast we can expect to see here as we enter our phases?
I don't, that's a good question for you guys. Sorry. I was just going to say, that's a great question for public health. I guess I don't feel like enough time has passed yet to have a good baseline or a, or a curve to understand exactly what we're seeing.
That's what I was going to say, that we haven't had enough time yet, at least for lay people, to have a good feeling for what we have learned.
Well, I think that we know what the plan is, right? That based on a phased approach, we go into phase one. If things look like they're ramping up, like our numbers start to spike, and this doesn't necessarily just us, but any of the counties that are going to be going into phase one, that the natural progression would then be to back up to the last step that we were at, right? So if we were at phase two, we would ideally back up to phase one. If we're at phase one, we'd back up to where we are right now, and then just kind of assess. That's why they're the 21 days in the phases, to try to adjust to any of the 2 to 14 day incubation period, plus the testing process and everything, that we could get a gauge on what our numbers are doing. So I think that it's just going to take a keen eye, which I can guarantee you the public health department has and is aware of, and is planning to do everything we can to ensure that the community is safe in this process, and that we have the most up-to-date information so that we can make the appropriate choices going forward.
I know in the case of parks, which we talked about earlier, that certainly if we find that we've taken a step too far, we'll back up very, very quickly. I know last weekend, I personally visited every park that we had open, and was very pleased with the activity, the level of activity, and the responsibleness of the activities, and felt comfortable relaxing our restrictions a little bit. But if I find we've gone too far, we will back up. And I think that's true of almost anything that we're trying to reopen. I hope that's true of anything we're trying to reopen.
Me too. I know that we have some concern, and there was some conversations in our live chat regarding just kind of the public verbally assaulting, vandalizing businesses that may be opening. I don't know. I know that we have had some concerns about the discrimination piece from those staff members of Shutter Creek, or anybody that may be considered or known to be positive, and that we as a county and you commissioners passed a resolution, about the discrimination part of it. I have not heard of the assault or verbally assaulting or vandalizing of businesses, and that would deeply disturb me if that was the case. And I hope we can come together as a community to figure that out.
Agreed.
Yeah,
Agreed. I don't think we get anywhere in this if we start attacking each other. I know that people are coming from a fear-based response. In many cases, people are frustrated. This is a very different place than any of us have ever been before. And, we really need to just calm down. I mean, we are in this together. We are moving forward, even though it's not as fast as some people want, and it's definitely faster than other people want. So people need to take the time to give each other a little grace, have a little patience, and realize that I want to say no one is trying to make anyone sick. I mean, you always read the off story, or you hear the off story on the national news, but the truth is no one's really out there trying to spread this disease. Maybe there's 6 people, I don't know.
I hope not.
I hope not too.
Kathy asks, are there clear parameters on park use to guide responsible use? Is there a group size number for gatherings at the park?
I'm glad Commissioner
Well,
Sweet is on tonight.
Yeah, well, 25, I believe, is the standard around the state. We don't allow 25 people at any one camp spot. The maximum occupancy of any given camp spot is 8 people, and that would all be, generally speaking, in one family. Again, we're spacing. We're not occupying every camping space. It's every other camping space, so there's more room than normal there. No, I don't think we have put down a list of things that we're going to be deciding whether I don't think we have to. It's going to be a lot dependent on just how people behave. If they absolutely ignore social distancing, then that's a problem, and we'll have to deal with that. If we find that our day use areas are absolutely flooded with people, that's a problem. We'll have to deal with that. And maybe we close down the day use areas and just go with the camping areas. I know it doesn't make sense, but it's a lot easier for us to control the number of people in a campground if they are campers, because we insist on reservations. We know where they're coming from. We don't allow reservations from areas that we are out of the state or too far away in the state. We're cognizant of the governor's limited travel plan. So we're doing a lot to prevent the problems in the first place, but it's going to be dependent largely on people's behaviors, whether or not we can continue to keep our parks open and further relax the restrictions that have been in place, which simply have not allowed camping.
Kathy has a follow-up question, Commissioner Sweet, regarding that. She says, is that 25 people in the park total, or is that like gatherings within the park of more than 25?
Gatherings of 25, I believe to be the limitation. So if your church wanted to go to the park, you could not have more than 25 people in the group, and there would be insistence upon still social distancing. Those things. There's not 25 in the entire park.
And I think you mentioned this, but you've only opened it up to self-contained, like RVs, campers, things that have their own restrooms, so that people don't have to wander the park so much as that they have everything that they need self-contained, so that they can help in maintaining that social distance.
We simply feel, I mean, our people do a great job at keeping the restrooms cleaned up, but keeping them sufficiently clean, given how contagious this virus is, I don't know that we can do that. So that is why we have restricted camping to those people who have RVs and camper trailers. And this is getting a little trite, but it's BYOB, bring your own bathroom.
All right. Now the Parks Department's done a pretty good job. I know that you had pictures of some of the signage they made, right? So to try to help with the kind of guidelines as to what is to expect in the park.
Yeah, as you come into each park, there's a sign that that has talks about social distancing, and it says 6 feet apart, stay 6 feet apart, or you'll be asked to leave, or you'll be directed to leave.
All right. Got a question regarding short-term stay rentals. The individual asked, we were informed that as of May 1, short-term stay rentals such as VRBO, Airbnb would be opened. I just heard that has been rescinded and set forward until later part of May. Could you please tell me which is correct?
For Coos County, we rescinded it, and short-term stays were allowed again as of May 1st. That was a county by county decision. The governor's office never weighed in on that. Some cities also had their own restrictions. And I know that the North Coast has extended their short-term stay restrictions, but we have not.
I think Bandon has extended theirs, have they not, Melissa?
I don't know.
The city of Bandon, I believe the city of Bandon did extend theirs. Perhaps to the middle of the month. I'm not sure of the date.
Yeah, I know that initially they had said that they were going to let it lapse, and then they changed their mind and said they were going to readdress it. I want to say it's this week, early this week, yesterday, today, somewhere in that ballpark. I thought was the number.
I think it's today. I was looking. I had gotten an email, and so
more to come.
Yeah, as everybody knows, the emails have been very active lately. So
Tara has a question. I heard that there had been a plan for addressing an outbreak in the homeless population in order to reopen. Is that true?
Well, do you want to address that, Eric? Or?
I can, to a degree.
Sure.
We have had a homeless task force in operation for the better part of this pandemic response from an incident management process of public health. And this group was working together to figure out what it would look like in the event that COVID-19 were to be pop up in a homeless camp, and what the response would be doing. They did some very proactive things, getting kits to some of the homeless camps for sanitation and giving them hand sanitizer and lots of things to try to help keep them healthy in their living situations. They've done a lot to try to really work on what that would look like. They were able to move forward in some aspects of what isolation might look like, what we would do in the event that an individual was housed for isolation. They have addressed, and it's moved kind of us forward in a more global perspective based on the requirements for reopening, as far as not just the homeless population, but what it means for any individual that might have to be isolated. They did some really good work in forming the foundation of what that'll look like for us. And they are going back out to, I believe, meet again, and they're going to look at checking back in and figuring out if they need to make more of those kits and do more of that work within that population. So I'm pretty optimistic that group is working on getting as good a handle on it as they can.
Absolutely. And I know they're planning on giving us an update at our Board of Commissioners meeting tomorrow at 11.
Yep.
So that'll be great.
Which is also live streamed on YouTube under Coos County Meetings.
Thank you.
You're welcome. We're just getting into the technology.
We are.
Sometimes it works better than others. Let's see. Moving forward with opening, what are the plans for containment should our cases surge here? Well, I guess we kind of already answered that question. If in the event that we have an uptick in cases and it looks like something we need to back down to the previous step, that's the plan, I believe.
I don't believe we have a choice.
No.
I mean, if that's what Oregon Health Authority tells us to do,
Yeah.
that will be what we're required to do. We hope we won't ever find out, honestly.
Oh, we have a camping question, Commissioner Sweet.
Okay.
Says, I have a self-contained RV. Can my family members camp with me in a tent in my site?
No. I don't know the answer to that question. How many family members are you talking about?
Well,
we normally allow, common sense would tell us that each campsite is good for one housing facility. And if anything, I'm frustrated. The thought of running one spot and having multiple camps, tents and trailers on that spot is doesn't meet the test of common sense to me.
I can tell you that I know that, like, when I was a kid, and I know things have changed. I am no longer a kid, as you can tell.
Your parents didn't like you. They wanted you in a tent someplace else.
I want mine in a tent.
Right. You know, it's sometimes as a parent, it's nice to have your kids in a tent outside. And I've seen it happen on more than one occasion in more than one camp, site that the families will have a smaller tent outside, near the back of the trailer or whatever. And it's still underneath that number that might be the maximum occupancy for the campsite. Just gives a little bit more privacy for those individuals that are involved, I would imagine.
Mm-hmm.
So I would assume that is the direction that the person that asked this question is going. I can't say for a fact, but I can say that I've done it.
I think we have limitations on how many people can stay in a site. Commissioner Sweet, isn't that correct?
Yeah, we do. I believe it's 8 people. I believe it is. I'm sorry, I don't know that number exactly. I suppose if a child wants to, or a couple of children want to sleep out in the tent, that's fine. But if the idea is to rent one spot and bring in multiple tents and lots of people, that's not what we're trying to do. We're trying to make this a good experience. We're trying to be safe. We need to be reasonable.
And they did clarify. They said it was the kids usually sleep outside in a smaller tent and not in the RV with the adults. So I think that was,
yeah. That's great. That's fine. We've seen. I've just too often witnessed that taken to an excess, and people are taking advantage of the park system, and they're taking advantage of their neighbors by crowding more than an appropriate number of people into a campsite.
Sure. And it might still, there's Tom commented below, it still seems to meet the bring your own bathroom test.
Yeah.
As long as you go into the tent, hopefully, or not in the tent. Don't go in the tent. Go into the RV, please. These are live. I don't know what to tell you, Commissioner. Oh, anyway. Fun times. So we've got about 12 minutes left. I have one question that has to do with sick leave, kind of sick pay. Is that something you think you'd be able to address?
We are not sick pay experts, but go ahead. We'll give it a try.
The FFCRA, does anybody know? I don't know what that is. Mentions an employee may be eligible for up to 2 weeks sick pay if they have COVID-19 related symptoms. Is this an employer out-of-pocket expense, or is there a government reimbursement fund that I need to apply to in order to receive reimbursement for those funds? I don't know.
Yeah, no, we dealt with this at the county too. As far as I know, there are no reimbursement funds for this unless you actually received CARES Act funding and you can use that back on your salaries, is my understanding. Commissioner Sweet?
Yeah, I'd have to check with HR to have an answer for that. There are a lot of rules and it's hard to keep up with everything. So yeah, if someone would, if you can get that person's name and address, our phone number, one of us will get back to them.
That was an email that we received, so we can make sure that we get that contact information and people. And
yeah, perhaps you could check with Caroline in the morning. I think she could give you a really good answer for that.
I will have my PIO do that.
Okay, good. Thank you.
We're out of questions for reopening.
Huh.
I know.
Oh,
What was that, John?
No, I said, well, I'm glad that's all there were, but I wish there were more, I guess.
Well, I think that we're at a point where we only know what we know, right? We've applied for the ability to open up into phase 1. It was submitted, and now we wait and find out what the answer is to be. But we are I think it's safe to assume that we anticipate opening.
Is going to be approved, and we will be ready to reopen on the 15th. The commissioners, as part of our reopening, as part of that application, we reviewed all 7 of the prerequisites. Coos Health and Wellness reviewed those 7 prerequisites.
And then one presumptive that is related to that one case. So there's only one true positive outside of Shutter Creek Correctional Institute. I can answer that. I know that answer.
So when people look at the numbers, you guys send out an email every day, Eric, right?
Mm-hmm.
That shows that. And so positive cases show up and then presumptive cases show up down below, right?
Right. If you sign up, if you go to the Coos Health and Wellness website and you go to the COVID-19 page, there's the ability to sign up to be on the situation status report email. And when you get that every weeknight, right around, I think it comes around 8 o'clock, it'll come in your email. And what it does is it tells you the breakdown of all of it. It says what our positive cases are, what our negative cases are, what our pending cases are, and then what our presumptive cases are, and then what our total cases are. So if you go onto the Oregon Health Authority website and you look at their COVID-19 page, it just says a number, like positives, and then the negatives, and then the total. So we break it down a little bit more into detail so that you can truly understand what Coos County's numbers look like. Now, it's not broken out per se into Shutter Creek versus community, but it does give an overall understanding. And then we're always willing to answer that question on Tuesday nights at 5:30 to 6:30 p.m. on our virtual town hall.
Excellent.
We got a question from Rick. This is, what are the specific plans for testing, isolate, and quarantine as required? I assume he means for the phases for the reopening piece. I know that the testing it's 192 per week per the guidelines set forth for our for the requirements. Yeah, right. The isolation and quarantine piece, Rick, is that any individual that is positive for COVID-19 that does not have the capability to isolate at home would then be isolated at like a hotel, and then we go from there. Yeah, that's pretty much, it's pretty much the long and the short of it.
Yeah, and the testing determination is done on a regional basis,
right. And
we are in health regions 3 and 5. That includes Coos, Curry, Jackson, Douglas, Josephine, and Lane counties. And what it means is we have to be able to take the tests and get them in and get them back. Since we're rural, I believe we did meet the 4-day turnaround requirement instead of the 2-day turnaround requirement from what I've seen. So Curry County has the rapid testing machine. Coos Health and Wellness would know more about how that's going than I do. I know that there was a hang up at first about getting enough media to be able to do those tests, but I believe that supply pipeline has opened now and they're able to actively use that machine.
Yeah, I believe that is the case. Alyssa has a question. Are some Shutter Creek related cases in our community and not at the facility itself? Well, yes, because 2 of them are staff members, and we did have one adult in custody that was released and then was later to find out had COVID-19. However, our contact tracers have been doing an absolutely tremendous job at ensuring that those individuals involved are doing all of the things that they need to do to keep themselves safe and keep the community safe, and that they go above and beyond as far as the contact tracing requirements that we have in order to ensure that remains the case. So I feel very good about our team and the effort that they have put forth to ensure that all of those positive cases and presumptive cases are being contacted, checked in on, and ensuring that they are following the proper guidance. Well, I want to thank you, commissioners, for being here. Is there anything you'd like to say before we wrap it up?
I think we all just appreciate the hard work that everybody's doing to keep everybody in the community safe. And that includes our staff, our partners, and other elected officials, and of course, the community itself. We know how hard this has been on people, and we just really appreciate the effort that everyone's made.
Commissioner
I'll
Sweet.
leave it at that.
Oh.
No, we're all in this together, and I think if we are respectful of each other's well-being, that we're going to come through this just fine. But if we fail to abide by the guidelines, our chances of a successful reentry are going to be reduced. I have every expectation, however, that we will succeed in this and we'll get back to some new level of normal. It won't be the same. And it certainly won't be the same until we have a vaccine that will take care of this illness. But in the meantime, we hopefully can get back to enjoying the outdoors and enjoying being able to shop and get a bite to eat out, visit our families.
I think
we can do that.
I think you're right. I think that something you said really resonates with me is that you said it's not going to be the same. And I don't think that that's necessarily a bad thing. Maybe through this we learn something. Maybe through this we learn the respect we have for each other and the respect we have for keeping each other safe and healthy, and that it is a community response to doing that, not just in COVID-19, but just in general, that we as a rural community that is not very big and knows most of each other, right? You can't run into Walmart and not run into 15 people that you know. That we take this time to understand that we all impact each other. We are an ecosystem that works together, and if we can't work together, we can't work at all. And I think that we, moving forward, could really learn something from this. And I think it not being the same as it can be a really good thing if we choose it to be. So thank you for joining us, Commissioner Cribbins. I hope you can enjoy the rest of your birthday.
This has been great. Thanks for having us.
All right. Thanks, everybody. And we will see everyone next week. Same bat time, same bat channel. So until next week, this is Coos Health and Wellness. Thanks, everybody.
You need a theme song, Eric.
I do.